Welcome to Accessible, the podcast that opens the door to disability leaders and their ideas. I'm George Gatto.
And I'm Amelia Reigard.
We are doing something a little different in this special series called Voices of the Network. Over the next few episodes, we will highlight university centers on disability, which are currently facing funding uncertainty in the proposed 2026 federal budget.
We'll explore how these programs came to be, their bipartisan roots in the Developmental Disabilities and Bill of Rights Act, and the impact they have on people with disabilities, families, and communities across the country.
Through conversations with national and local leaders, trainee alumni, and professionals, we'll shed light on the real-world value of UCEDS, LENS, and other DD Network programs. These are stories of leadership, innovation, and impact.
Today's episode is all about the Missouri Leadership, Education, and Neurodevelopmental Disabilities, or LEND program. We were lucky to sit down with two incredible guests, Dr. Rose Kammerer, a clinical psychologist and co-director of the Missouri LEND program, and Carson Miller, a doctor of physical therapy and a proud LEND alum. Together, they give us an inside look at how the LEND experience shapes future professionals, and why this kind of training is so important for building a more inclusive, responsive system of care. Whether you're new to the world of disability services or have been in it for years, this conversation will leave you inspired by what's possible when we invest in interdisciplinary training that centers people with disabilities and their families. Enjoy.
All right, we are really excited about today's podcast episode. We are going to spend some time talking with Rose Kammerer from who's the director of the Missouri Leadership, Education, and Neurodevelopmental Disabilities Program, or the LEND, and then Carson Miller, who is a former trainee from the Missouri LEND. So welcome to both of you, and thank you for joining us.
Thanks, George.
Yeah, thank you.
Well, let's just jump in and Rose, I know you've been a guest here before, so we don't have to go too much into your background. But if anyone wants to learn about Rose's background, then you can visit that podcast. But traditionally, our listeners, or throughout this podcast, we've had our listeners, or thought of our primary listening group as the LEND trainees. But what we've learned is there are a lot of folks who are listening to the program who maybe don't really know that much about what a LEND program is or even what it does, my mother included. So we always have one listener in Colorado, so thanks, Mom. So anyway, with that, what is kind of your best definition of a LEND program, and then if you could talk a little bit about why it matters that we have these.
Yeah, so our LEND program really focuses on training lots of different health professions in autism, neurodevelopmental conditions, but also in a way that is interprofessional, so collaborating across those professions so that you're not just good at what you do as a speech language pathologist or physical therapist or psychologist. It's really training you to understand some of those other professions, while also training you to be a leader, to have good communication skills, to really focus on families as individuals and really focus on what their needs are as a family versus just kind of having this cookie cutter manner in which we treat or work with families. And we also really have a big emphasis on policy and advocacy. So not only training our trainees to be good at their profession, but also to understand that goes beyond just the healthcare realm, and they need to be advocates for the folks that they work with as well. And then a really cool component of our training program too is that we have folks with lived experiences at the table with everybody. So we oftentimes have a family advocate, and that's oftentimes a parent of a child or an adolescent or a young adult with autism or other special health care needs. And then we also have a person that has a disability at the table with us talking about their lived experiences as well. So it's a really cool training program. It's very intensive, but I would say our trainees come out from that training program with such a rich understanding of what healthcare is all about.
Yeah. So when you think about those students and the students who are drawn to the Lind experience, is there a common spark or motivation that you see in them?
Yeah, I would say our trainees care a lot. And so they are folks that are really driven to do the best for the patients they're going to serve. They're also kind of natural leaders, or sometimes we tease them and say they're overachievers because they just want to get as much out of their training as they possibly can before they are just out in the world doing what they're about to do. So I would say those are some common qualities from our trainees.
Carson, as a former Lind trainee, what drew you to the program?
I'm a physical therapist, so in PT school, I knew that I always wanted to work with not the typical PT population of like sports or work injuries or whatever it is. And I was always drawn to kind of the pediatric neurodevelopmental side of things. And I did a lot of work, a lot of volunteering in college with like some of our Special Olympics programs. And we have Mizzou-Thon, which raises money for the NICU. And there's just a lot. I don't really have one thing that I can point to. I get asked that question a lot. It's more just like I knew that was the population I enjoyed, the population I was kind of drawn to, and it just made total sense to learn more about it and get some of the more of like the policy side and learning a little bit deeper about it, stuff that you're not going to get from just like your typical volunteer experiences.
Yeah. And I guess I'm curious, Carson, from the student side, if you talk a little bit about like what the LEND program is like and how that matches with your degree, right? So it's something you apply to, you do it on top of your physical therapy classes. How does that work together so people get a sense of like, this is extra training. This is in addition to what you do.
Yes. And I would say the perspective has changed a lot since I was a trainee, 6 years ago now. So at the time, it was like kind of an additional, there's an application process to go through. So although it was extra work, like you knew that there was extra work and you felt lucky really to be a part of the program because of like the opportunities it affords you that you aren't getting in your regular classes. So, obviously your professional school prepares you for really one big test, and they do a little bit of sprinkling in patient dynamic type things throughout the curriculum. But really it was nice to kind of step away from the traditional like study, take a test, and really just like hear from people, and then you get to kind of take away from it what you need, or what, I guess at that point, what you think you're going to need going forward. And I would say that has changed a lot from what I thought I would use from the program to really what I feel like I got out of it in the end. So I thought I was going to have to be dealing in my day-to-day job with all the like legislation and all that stuff, which I don't really love on a personal level. So I was like, trying to cram it all in and almost do it like school and be like, okay, I got to learn all this stuff because I'm going to be the one telling people about this. That didn't really happen. But the value that I found in it, I guess now, is it really laid a great foundation just working with really other high achieving, at that point, grad students that are now professionals in their field, and getting to learn with them, but also getting to see kind of their perspectives and what is their job in healthcare, because that's not really something that you get in a PTOT speech psych program. They try to mix interdisciplinary things in there, but there's just not time to really spend with other disciplines and learn the same things with other disciplines. So it made a ton of connections for me, which I've used probably monthly. I talk to somebody that is associated with the program, and it really just speeds up how I'm asking for information and who I'm asking for information, because I know what everyone's role is, on top of everything else. I would say, and Rosie talked about it, but the parent advocate was huge. I mean, at the time it was really cool that, we had a parent there, and it was like, oh my gosh, I can't believe that's your experience in the healthcare system. But now that's almost all of my patients. So really that was my only opportunity before just being thrown into work to get to hear some of those perspectives and really understand that as a healthy college student at the time, I barely ever utilized the healthcare system. And that was a majority of my class, and really all the grad classes, I would say. We don't have a lot of experience within the healthcare system, utilizing the healthcare system. And so hearing things, I was like, oh my gosh, well, that probably doesn't happen very often, when the parents were telling me about good or often not so good experiences. And turns out that happens a lot. So being able to hear that early set a really nice foundation to kind of open my eyes earlier than it would have, I think.
As you all know, we do the evaluation for the LEND program, and every year, I would say one of the top one or two things that the trainees identify as being a real positive of the program is that family interaction and just hearing from families. So it's kind of neat to hear you explain it.
And I also like that bit about, some of the efficiency piece of it is that we oftentimes don't get that training to know how our jobs actually go. We have the specific skill sets of what we're supposed to do clinically, but all of those bigger, higher level, meta level things that happen in our jobs that nobody really is talking about, and you're just supposed to figure it out. It kind of fast tracks you and makes that system a lot more efficient for us as healthcare providers, but also for that patient too. They're not waiting on us to figure out, oh, it would make sense to make a referral to this person. You just kind of naturally work that way because you've been trained at this higher level. So it just makes things run smoother, I think, for folks that are coming out of that program without having to do that learning curve.
Yeah, and I tell we get, a lot of students and new grads that come through the clinic that I work at, and I tell people all the time, they're insanely stressed. And I say, your first 6 months, you're learning how to do the job. You come in day one and you're like, okay, my patients are going to look like my textbook. And I haven't had one of those yet. So to Rosie's point, having this little bit of extra foundation that you don't have to crash course in, because there's already a lot of crash coursing happening when you step into your job. People are not cookie cutter. Everybody's got this little thing added on that makes them more complicated. So if you can have this little foundation and, you come out of the program with lots of resources and who to ask questions to, like I mentioned earlier, that's huge. And looking back now, I was just stressed about it at the time, but looking back now, it really did give me kind of a one-up especially in those first few months of like getting my feet under me at work.
Rose, if I remember correctly, you also were a trainee at one point, and so yeah, like what drew you to the LEND program?
Yeah, my background is in school psychology, but I practice as a clinical psychologist, and a lot of my early practicum were within the schools, which makes sense if you're in a school psychology program, but that wasn't my long-term goal. I really wanted to work as a clinical psychologist, but kind of soak up all of the things that I could. And so I got really nice training within the schools and understanding those systems. But I felt like there was a gap in what I was learning as far as understanding and navigating that healthcare system. And, working specifically in the field of autism, I felt like, okay, I've got a fair understanding of what this looks like in the schools and from a psychology perspective, but really I didn't know what any of these other professions did. That was not part of our training. If you happen to be working with a kiddo that also saw a speech language pathologist, you might touch base with them a little bit, but I really had no sense of what they do, all the different things that they cover, and even understanding some of that overlap of what maybe psychology does versus what speech language pathology does versus occupational therapy. So I had no sense of what that looked like. And so it was sort of like the program felt a little bit like drinking from a fire hose at certain points of like, oh my gosh, this is like a whole different world that I haven't gotten exposure to yet. And I think that really propelled me to be competitive, to be in that clinical space after going through a school psychology program.
I wonder if you guys could say a little bit about the value that this type of training program then has on the people you're serving, right? Like what is that value for the individuals with autism or neurodevelopmental disabilities and their families? Carson, you're talking a lot about, I feel like it was a fast track into, I knew a little bit more about who I'm going to be working with and where I need to go if I need more information. Like how does that translate into the value for your patients?
Yeah, like I was saying, there's not a lot of cookie cutter people, not a lot of textbook people. So even though I'm seeing kids for a myriad of different, diagnoses, what the script comes in is, it might be knee pain, it might be incoordination, it might be a whole lot of things. But then you look at what else is going on in their life, and often autism or another neurodevelopmental disorder is listed there. So you're not just going to be able to treat every kid the same, even if it's knee pain, right? Like we're not doing our typical orthopedic round of therapy. So even the patients that you wouldn't think would come in and benefit from going through the program benefit from me going through the program, because I have a little bit of that background. And when, it makes a huge difference to families too, when mom's talking about the IEP process at school, or what they're getting or what other supports they're getting. Like all those were familiar to me. We had talked about all of them. I kind of even understood what that speech therapy session was going to look like. Or sometimes I could even make a recommendation that I would not have been able to make before, because I understand the scope of psychology or occupational therapy, or even sometimes like I have a great dental recommendation for you to go to, because like there are little things like that. Like I just had a patient last week that's really searching for somebody good to cut their kid's hair. And so there's like little connections along the way that you make or that you learn about. And while you're in the program, it's just like, I never really even thought about that. And then when you get to really apply it to like a patient and a family that comes in, it's huge. And for you, it's just like, oh yeah, well, I know this thing, and it makes a huge difference in their lives. So I would say that part of it, one, helps build that therapeutic alliance that I need to do my job. Like that's a really important part of what I do, I need to make a connection with the family and I need to make a connection with the kid. And just having an idea a little bit about what they're going through outside of just you come in, I look at your knee. That makes a gigantic difference in our families' lives and in outcomes too.
And I would echo a lot of what Carson said. I think, not that Len trained me to be a speech language pathologist or physical therapist, but, knowing enough and knowing what they do, I can at least recognize, hey, you know what? You should probably talk to a physical therapist because what you're describing or what you're going through is something that they can help with. And so even some of those connections for families of understanding what all of these professions do is really helpful. So making that a little streamlined for families that honestly, it's complex. It's really hard to navigate all of these different systems of care and knowing who to talk to about what, or even if it is something to talk about, or because our visits are so short. A lot of these visits, it's like you're kind of myopic on whatever the issue is that's happening. And so I think Len just helps kind of broaden what you're looking at and recognize some of those broader things that might be going on within a family and knowing how to sort of lead them to the next step versus saying, I don't know about that. Good luck. Maybe talk to your pediatrician. It helps give them a roadmap for what to do next that maybe they wouldn't get if you didn't have that interprofessional training.
I think it helps limit the number of almost, this is not a great term, but like guinea pig patients that you need, right? Because when you're first in a program or first out of school, you're on your own. So like you're using all the expertise that but like you really learn how to treat maybe your more complex patients by treating complex patients, and you learn over time what works and what doesn't. And so being able to shorten that time, and at least there's always going to be patients that come in and I'm like, I have no clue. I have no idea. But I have a lot of skills that help me get to the root of the problem. But being able to come in and have at least a little bit of an idea of what's going on, or somewhere else that they can try, or something that may be a good adjunct to what I'm doing, that's huge for them and for me as a clinician and my confidence in my ability to treat. So being able to just limit the amount of times you kind of have to throw darts at a dartboard is great for everybody.
And I would say too, being faculty, that same thing happens. So we talk a lot about the impact that Lend has on our trainees, but also our faculty are kind of doing those things in practice as well. As so, times when we have downtime or we're transitioning to another thing, I would say at least multiple times a week, folks are talking about, hey, can I ask you about, and there's some like consultation or collaboration that's happening because we're all in the same space and we're comfortable with one another to say, I'm not sure about that. I want your perspective, or what would you recommend? Or do you have any ideas for this? And it's so nice because it's that ongoing collaboration and consultation. So I feel like I still learn a ton just being faculty and getting to work with so many professions on a regular basis.
Yeah. I think one of the neatest things about the program, or something I've really appreciated, is that you do have the family advocate trainee, as well as the person with lived experience being a trainee. Can you talk about that and about how it impacts your thinking as well?
Yeah. So a lot of programs run this a little bit differently, but our advocates are full participants in our program. So they do all of the things that all of the other trainees are doing. So I love that model. I feel like it's really impactful for our advocates, and it's really impactful for our trainees. And I think, some of what Carson was saying earlier is that, like, it gives you this sense of what's going on outside of just what you're seeing in clinic. And I think for our families to have that experience, to say, here's all of my experience that I've taken away, they probably don't have a lot of opportunity in a 30-minute visit to say, this kind of negative thing happened with this provider. I wasn't sure how to navigate that, or, hey, I don't want that to happen again. They're just sort of going through the motions. So I think in some ways it's a little bit cathartic to say, these are my experiences, the good and the bad and the ugly, so that people are taking something away from that. And that feels really empowering to families and advocates, to be able to say, like, let's not do that. Let's do this. These were really positive things that I got out of the healthcare system. But then on the flip side, I think for our trainees to take a step back and say, hey, I might not be getting the full picture when I'm spending 30 minutes with the family doing an intake or whatever it is, to think, what are some of those broader questions I can ask the family, or check in on some of those things, or just honestly ask how the family is doing, because we're so, there's a big push for efficiency in our visits, but also better healthcare comes from understanding all of the different things that we're going through as a patient. So I think both sides of it, it feels like they're all learning so comfortably together that I just think it changes folks' perspectives in a really radical way.
Yeah, that's awesome. I feel like that reminds me of something Carson said earlier. And, I come from a social work background and lens. And so, and we talk about this here at the Institute all the time, George, is that the person, they live in the context of their family and then in the community. And so it's like thinking of all of the, those levels in which that they're doing their day to day, and that all impacts one another. And that this LEND training experience, the interdisciplinary piece of like meeting others, the working with families, having family and self-advocates as trainees, all helps broaden that perspective. So people are looking beyond just the patient, but what is the context that comes with it.
And for me, at least, that was one of, and maybe still has been, the only opportunity where I've really gotten to be like in a group with someone with a mutual goal. Right now, when I see patients, like, I have goals for the session, the family has goals, but like it's kind of a goal for my patient, not really me and them working together towards one for both of us. Like, yes, we work together, and yes, there's a lot of family-centered care, but it was an opportunity to like be in a group where we all had to brainstorm together. We're all on the exact same level, whether that's just the multidisciplinary team, whether it's the self-advocate, whether it's the family advocate. And so I think it's one of the few times that it really gives like the self-advocate or the family advocate an opportunity to be on the exact same playing field. Although we would love for that to happen all the time in healthcare, it doesn't. And so it's really great to see that perspective and like be able, it's just a very unique opportunity to be in a group like that.
Yeah. So I guess for both of you, what is one thing that you've learned through your experiences with LEND that you wish everyone in your field knew or could experience?
I think it would be maybe the importance of understanding different professions and how we all interconnect, and that, we have a didactic on this where we talk about, like, when people are not talking to each other and communicating as a healthcare team, it's super inefficient. It has high risk for negative things happening. And so, I think that emphasis on communicating with the people that you're working with, even if you're not in the same building. But, we have really easy, efficient ways to communicate with one another, that just shooting a message over, our electronic medical system to say, hey, I saw this patient of yours. There's some consultation there, or some just communication across folks, so that you're not relying on folks to just read your notes that you're writing, because we know that there's a lot of notes in there sometimes, or our reports are really lengthy. And so being able to efficiently communicate with folks so that our families and our patients have better care, I think is a big takeaway, and something that I practice all the time, that I don't necessarily know I would have that same mindset or that same orientation without Lend.
I have a quite similar thing, but the Rosie kind of highlighted the importance of it, and us almost remembering to do it. But I think one of the big things that I took away was when you're in school, and then I talk a lot about this transition to work, and when you hit that, you don't really know what you don't know until you have the person in front of you. And there's, I think, a little bit of anxiety sometimes about reaching out to other providers. And for different people, it's different things. Like, you don't want to sound dumb. You don't want to sound like you don't know what you're talking about. Sometimes you don't really know who to ask. Sometimes you feel burdensome by doing that. And so in that transitional period, having other people at your stage of life and career that you can ask those questions to, but also you just left a room with really great mentors in that space too, who are happy to answer those questions for you. So it really takes away all of that hesitation, I guess, or anxiety of reaching out your first few times. Once you get your feet wet, it becomes second nature, but sometimes it's really hard to get over that hump and ask questions the first few times. And I think the Lend program itself, pun intended, lends itself to being able to do that more quickly.
Yeah. Wow. What a powerful experience. As a beginning professional, early career, being able to practice that skill of being grounded in your own expertise in your field and your lens, and also knowing you can have questions and that you can confidently ask, and that's part of collaboration. You don't have to, pretend you know all the things, right? Because that just gets us into sticky situations. So that's such a powerful, I feel like, learning outcome of Lend.
Yeah. And I didn't even realize that it was something I gained from it until now. I'm seeing new grads that didn't have that. And then they come to me with questions, and I'm like, well, ask them. I don't know. And that was looking back, I was like, holy cow! I didn't have to get over that learning curve.
I think something really cool that we did this year was, we have this policy component of our program. And sometimes it's hard to fire people up about policy because it feels really intimidating, or it feels like, oh, I could never do that, or I'm not equipped to do that. I don't really understand all of those systems. So this year we brought in 3 of our legislators from Missouri, and we just kind of had an open panel discussion with them. But afterward, we had some time where our trainees and these legislators just got to chat with one another. And I think it was really, really eye-opening for our trainees to see wow, you have all of these elected officials that are asking us questions about what the healthcare system is like, and specific questions about autism, because they want to understand, but don't always have that time or capacity to be, reaching out to all of these folks. But I think it put them into a really unique position where they realized, oh, legislators need us to tell them what is going on in our field. And I think it just made it really attainable, or it made it less scary for them to think about, hey, these are just people too. They want to understand so that they can, inform other legislators. They can advocate for us, when bills are being passed. So I think that was a really, really cool experience. We're already, kind of plotting what we're going to do next year of just how can we continue that, improve on it, because I think that was a really helpful experience for all of them.
I will echo that because we're actually analyzing the data from the evaluation right now and working on that report. And I think that was the number one thing that the trainees mentioned this year is how impactful talking with those legislators was. Like they really got a lot out of that particular panel.
Our resident policy nerd. So Nathan is one of our graduate students, and he'll be our postdoc next year. That was his brainchild, and he, really hit it out of the park. And, I think that's really exciting to hear that they also got such a good experience out of that as well.
Yeah, they definitely did. So speaking of policy and legislators and all of that, we all know that we're in a little bit of an uncertain time in terms of funding around LEND programs. And so without getting too policy heavy, I just wonder if you could each talk about what it might mean to students and families and communities if there weren't a LEND program or if it was significantly reduced.
I can talk a little bit about at least like our area of Columbia is a decently close-knit healthcare community, I guess. I mean, the University of Missouri is most of it, and we have another hospital in town too, but they don't have quite as much reach. So within our system, I mean, healthcare, and I think you could probably argue the world is moving less and less collaborative, even though we know that we need to be more and more collaborative. It seems to be moving the opposite way. And like Rosie was talking about earlier with the efficiency pushes and, streamlining everything, there's just not that time to take and really discuss these complex patients that you're not going to be able to treat in a silo. Like if everybody just does their part and we don't connect it, people aren't going to get the best care or sometimes better, depending on what it is. So without having people that are trained and then going out that have that baseline experience of where communication is expected and necessary and they understand that, I feel like the movement is going to continue where everybody just gets their magnifying glass out and looks at their thing and then says, oh, well, that's a psych thing. Oh, well, that's a speech therapy thing. Oh, well, and I'm here for my specialty. So I think that's a real risk in care moving forward. And especially as people transition to telehealth, which I think telehealth is awesome, but it makes all the more necessity to talk to providers who are seeing that patient in person. There's just a lot of healthcare transitions happening right now that are less collaborative and not more, and the program really is all about collaboration. So I just think it's completely at odds with what we need.
It's a really insightful response, Carson.
And I think too, hearing Carson's, perspective on, maybe those first couple years, getting your feet wet in the profession. I think that there is a lot of potential for burnout of healthcare providers, especially as we push towards this really, high efficiency model of healthcare, is that it's tiring to do that. And if you don't necessarily understand, the systems of care that you're in or the policy, or feel like you have those leadership skills to advocate for some of that. You're just sort of that like cog in a wheel kind of situation. And, if it's overwhelming and you're not really sure how to make that better, I can imagine that a lot of folks are not going to stay in these fields. They're going to find something else to do. Because at the end of the day, healthcare is hard. It is hard emotionally. It is hard just as far as, making sure that you're having that work-life balance. It's hard because we don't get paid at the level of like private sector things. So it's sort of like you do it because you love it, but when it's really hard to feel like you're making a difference or really doing things in a way that's fulfilling to you, I think that, just risk for burnout is really scary because we already don't have enough providers. And I also think that for a healthcare system to understand disability and to know what that looks like and the different things to keep in mind, like I think that for a group of folks who are already kind of set aside in a lot of ways in our society, that's going to feel a lot more isolating for them to not have healthcare providers who understand their experiences and who are willing to take a step back and say, okay, what is the big picture here? So I just think, there's going to be a lot of folks who are going to get less intentional care. And that has really big consequences for people's health, well-being. So it feels a little bit scary of a landscape.
Yeah. Yeah. Thank you both. That was great.
Yeah, I think one takeaway I'm just having from hearing your comments and is that I think that we operate under assumptions, right? That our healthcare providers are coming out of school like just ready to go with all the knowledge that they have. They passed the test, like Carson was saying earlier, so they're good to go. But that training programs like LEND are really preparing people to be practitioners of whatever field or discipline that they studied. And so what a valuable resource that is. And, as a person who engages the healthcare system for myself, but also a parent, it's like, I want to know that my practitioners have that level of training and knowledge, feel confident and comfortable in utilizing their expertise and collaborating with others because you want the best for your kids and their healthcare. So I think that's something I'm walking away with from this interview. So thanks for sharing.
So I guess our kind of final question for you all is that if someone had never met a person with a disability or never thought about inclusive care, what would you want them to leave this conversation with? What understanding?
I think a big, if you don't know, ask, and that's harder than it sounds because you don't. I think especially as a young professional or even a seasoned professional, for some folks, it's hard to admit that you don't know certain things, but to take a step back and to have that humility to say, like, can you tell me more about that? Or, what does that look like for you on a day-to-day basis? Or, I'm not familiar with that. Can you explain that more? Goes a long way because you don't know what you don't know. And so being willing to just kind of ask the questions that you need to and be curious about your patients and not get into that rut of just, oh, it's another patient. Like I do this every day. Like it's every day for you, but it's not every day for that patient to be seeing you as a provider.
I get the opportunity to see people multiple visits, typically weekly, sometimes twice a week. So one of the big takeaways for me is it's really, and I tell students this all the time, like it's really not hard to find common ground. And then once you find something that you're mutually interested in, you're in. And then your friends, and then it makes it way easier to ask all those questions too that Rosie was just talking about. Like, it's only scary if you make it scary. Like, everybody has interest, everybody has fun, quirky things about themselves. Like, find what that is. And even if you need for that to be your discussion point for the next 4 weeks, great. You're going to learn all kinds of stuff about whatever topic it is. But being able outside of healthcare to just like have a conversation with your patient as a person makes the healthcare part way easier. So as fast as you can, even if it doesn't pertain to what you're seeing them for, like, just find some sort of common ground, find a mutual interest, find something that you want to learn about from them, find something that they want to learn about from you. It doesn't matter. Find talking points. And it just makes everything flow so much easier.
Great. That's awesome. Well, thank you both so much for spending this time with us and sharing your insights. It's been great.
Yeah, Missouri is lucky to have such great practitioners and to have this program. So, yeah.
Thank you both.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.